Hi, I'm Joe, and I'm here with Jennifer.
I just have a few questions for you, Joe, about your experience with vision therapy. What brought you to our clinic?
Well, what brought me to the clinic was I was having some trouble with motion sickness, mostly motion sickness and depth perception problems and my personal safety because of my visual impairments.
What things were you struggling with when you first came to see us?
Well, those things mostly, that I would go on a trip and I would arrive feeling very poorly, or I was having accidents around the house, and I had an awareness that I had almost no depth perception.
How was the therapy process for you?
It got off to a little bit of a slow start, I would say, but the more I committed to it, the more I got out of it. There was a lot of work to do at home with protocols and patching and just paying attention to how my brain was processing visual information. And then I think the turning point came when I started doing the syntonics. And after a few weeks of the syntonics, which quieted my nervous response to the visual stimuli, then I really was able to accelerate through the therapy process, get a lot out of it.
Great. And I know that you and I had talked a lot about just some different things with social anxiety and things. Could you elaborate on that for me?
I didn't realize what I had always thought of as social anxiety was related to my vision and to my processing. So I had anxiety about going to new places or meeting too many new people at once, and would either avoid these situations, or I would want to, let's say, go see a restaurant before going to the restaurant, or go see a classroom before I had to teach in it, that sort of thing, where I had a visual map of the space that I was going to. And I found that since doing the vision therapy, I don't have that issue anymore, and I'm really comfortable going to a party, or I'm comfortable going into a new restaurant or something without that anxiety, which is a real life-changing thing.
And lastly, as you completed the program, where are you now?
Well, I'm still paying attention to how I process things visually, but I think just where I am now, I have an awareness of my depth perception. I'm much calmer in general. I have far fewer accidents. I don't struggle with motion sickness. I don't have anxiety around travel or new places or meeting new people like I did, and I just have a much higher quality of life.
Yeah, because you were saying how now you're going to travel possibly with a band.
That would have been pretty daunting to think about going on tour in a foreign country with a band, but now I feel like it's no big deal. Seems like fun. Sign me up.
And then, of course, would you recommend vision therapy to others?
Well, in fact, I have recommended vision therapy to others, even people who don't think of themselves as having a profound visual impairment like I presented with as a child. And so I think that there are a lot of people who can benefit from vision therapy.
All right, well, thank you.